As published in Oral Health and Preventive Dentistry, the results of a study conducted at St. Louis University Center for Advanced Dental Education and Southern Illinois University School of Dental Medicine suggest that SmartMouth Clinical DDS Advanced Oral Rinse is an effective over-the-counter alternative to prescription chlorhexidine mouth rinse. We conducted a study at both universities to compare SmartMouth Clinical DDS Advanced Oral Rinse with chlorhexidine mouth rinse and a placebo. The subjects were dispensed a mouth rinse and were not aware of which rinse they were using. SmartMouth Clinical DDS Advanced Oral Rinse has anti-plaque and anti-gingivitis properties and is available over the counter. Chlorhexidine rinse also has anti-gingivitis and anti-plaque properties. It's typically used short-term and is prescription only. The placebo mouth rinse was the same as SmartMouth rinse, except there were no active ingredients. Our examiners were calibrated for scoring and were not aware of which mouth rinse the subjects were using. The following clinical measurements were taken at 3 time points: at baseline, at 3 weeks, and at 6 weeks. Gingival inflammation and bleeding score to assess gingival inflammation, tooth stain index to assess tooth stain, calculus index to assess calculus accumulation, and plaque index to assess plaque accumulation. At the beginning of the study, all subjects were given a dental prophylaxis to remove all plaque, calculus, and stain. The subjects were then dispensed a toothbrush and floss and given oral hygiene instructions. Then they were given a 3-week supply of the assigned mouth rinse and instructions for use. The subjects were returned after 3 weeks and the measurements were repeated. They also returned any unused rinse so that we could monitor their compliance. At that time, additional rinse was dispensed. The subjects were seen again for the final visit at 6 weeks. Measurements were repeated, any unused rinse was returned, and the subjects also completed a taste perception survey. We found some interesting results. Gingival index and bleeding was reduced for all groups with no significant differences between them. There were significant reductions in plaque index for all groups with no significant difference between SmartMouth and chlorhexidine rinses. Tooth stain was significantly greater for chlorhexidine compared to SmartMouth or placebo at both 3 and 6 weeks. Calculus index scores were reduced for all groups with no significant differences between them. Subject compliance with regard to mouth rinse usage was significantly higher for both SmartMouth and placebo rinses as compared to chlorhexidine at 3 and 6 weeks. There are some important findings from this study. SmartMouth and chlorhexidine mouth rinses both exhibited significant reductions in gingival index, bleeding scores, and plaque index over the study period. These changes were not significantly different from one another. It is interesting that SmartMouth was the only mouth rinse that exhibited increasing plaque reduction throughout the entire study period. As expected, tooth staining was significantly higher for chlorhexidine as compared with SmartMouth. And this is one of the reasons that SmartMouth may be more suitable for long-term use. The survey revealed that subjects found the taste perception change was greater with chlorhexidine than with SmartMouth. Another factor is compliance. If patients don't like and don't use the rinse, it can't be effective over long periods. SmartMouth compliance was significantly better than chlorhexidine, and that is a very important finding. In conclusion, both SmartMouth and chlorhexidine rinses resulted in a reduction of gingival inflammation, bleeding, and plaque. Tooth stain was significantly greater with chlorhexidine, and there was less taste alteration and better compliance with SmartMouth Clinical DDS Advanced Oral Rinse.